Hello, my name is Professor Charles Kingsland and I'm the Chief Medical Officer at Fertility. At your first consultation, your doctor will review your medical history and all your test results and explain them to you. If you've had fertility treatment in the past, this will again be discussed in detail. Treatment plans are always personalised and can be very simple, such as medication to boost ovulation, or more complex like IVF. Around 40% of fertility issues are sperm related, and there are additional techniques which are designed to address those challenges. We try to give patients an understanding of their potential personal success rate and what to expect from treatment. We often find that after the consultation, people may think of additional questions they want to ask, or they may have something they want to clarify. At Care, we have a patient team called Care Pals, who are available to contact following your consultation to guide and advise on next steps and answer any questions. Before you start treatment, there will be education modules and treatment consent forms to complete. The next stage is the beginning of treatment. The first phase begins with a fertility drug, which is a hormone injection to stimulate your ovaries to develop the eggs which will be used for your treatment. We monitor you while you're having these injections with serial ultrasound scans to measure the response and to establish the best time for your eggs to be collected. We will then advise you when it is the right time to take what we call the trigger injection. This very last injection is called an HCG trigger, and it allows your eggs to complete their final maturation before egg collection. This is the next stage of your treatment, the egg collection. This is usually planned 36 hours after you have taken the final trigger injection. You will always be given clear instructions about the date and time of your egg collection and when you are expected to be admitted to the ward for the procedure. On the day of egg collection, when you're in the clinic, you'll be welcomed and admitted by one of the nursing team to the ward, and they will prepare you for your egg collection. Your egg collection will be done under sedation. The egg collection procedure itself is relatively simple and straightforward and is carried out transvaginally. It takes about 10 to 20 minutes, and at the end of it, we hope to have collected 80% of the eggs that are mature. Once your egg collection is complete, you'll be taken to the recovery bay in the ward, and your nurse will look after you and make sure you're comfortable and pain-free. You'll be usually given something to eat and drink so that you are nice and comfortable before you go home. If your partner is providing sperm, or if you're using donor sperm, that will be thawed on the day, and the sperm sample will be analysed to check suitability for treatment. The embryology team will call you and update you to confirm the number of eggs collected and that the sperm sample is suitable to go ahead with treatment as planned. Once you've gone home, we will continue to stay in touch with you. One of our embryology team will update you on how your embryos are developing and give you time and a date for your embryo transfer, which is commonly on day 5 after your egg collection. Following egg collection, the eggs will be put into a special culture medium and safely transferred to an incubator to provide exactly the right environment and temperature conditions. We spin the semen sample in a special media to isolate the dense, good quality sperm. We then wash the isolated sperm in another media to purify the sample. Next, we fertilise the eggs with the sperm to form embryos. We then grow the embryos in carefully controlled conditions until they're ready to be transferred into your womb. The first signs of fertilisation are shown by the presence of 2 nuclei within the egg. If this has occurred, the fertilised egg should then divide into 2 and subsequently 4, 8 or even more cells in the embryo. At this stage, a nurse or an embryologist will arrange a time to give you your fertilisation result and also a date for your embryo transfer. This is the most important step in your treatment, the day of your embryo transfer. The embryologist will give you a date and a time for you to arrive in the clinic, and when you arrive, you will be admitted to the ward by the nurse and given a final update on the status of your embryo by the embryology team. The embryo transfer procedure is very straightforward. It is almost always performed without the need for sedation. Your specialist doing the transfer will carry out the procedure in theatre, and we use a speculum just like when you have a smear test, and the embryo is transferred into the uterus using a very soft catheter under ultrasound guidance. The procedure should not cause any discomfort and only takes around 15 minutes. You'll be able to go home whenever you're ready. During the period after embryo transfer, it's important to take the hormone progesterone. This helps prepare the lining of the womb for the implanting embryo. It's important that the progesterone is taken until the first pregnancy test. This period is often referred to as the 2-week wait. It can be challenging and it can seem like forever to pass because, of course, you're anxious to learn the result of your treatment. Try to stay positive. You've done everything you can, and if it helps, you could speak to others at the same time or at the same stage of their IVF treatment on one of the fertility forums. CARE has a forum with a section called the 2-week waiting room. Remember, you're not alone. Your clinic team understand that the 2-week wait can be an extremely anxious time, and they can support you. Around 14 to 16 days after your embryo transfer, you will take a pregnancy test. If your pregnancy test is negative, or we don't find an ongoing pregnancy during your scan, we know that you'll feel upset. Support is always available to you. You may find comfort in speaking with a specialist fertility counsellor who can help you to understand the process and the emotions that you may be feeling. When you feel ready, you can arrange a follow-up appointment with your consultant to discuss your next steps. If your test is positive, we'll invite you to come into the clinic 2 to 4 weeks later for an ultrasound scan to check for a heartbeat to show an ongoing pregnancy. Once this is confirmed, you'll be discharged into the care of your GP, who will arrange your antenatal care.